Hi, everyone. Welcome to our online Rett Syndrome Town Hall with the Vanderbilt Kennedy Center Rett Clinic in Nashville, Tennessee. So happy to see you all on this Saturday. I'd like to begin with a few housekeeping remarks on how GoToWebinar is working. So if you are attending for the first time, I wanted to let you know that your audio is automatically on mute and your webcams are off. So you can sit back, relax, drink your coffee, have your lunch wherever you are in your time zone and in your day. And you don't have to worry about your background noise interfering. If you look to the upper right corner of your screen, you'll see a control panel window. We invite you to type your questions and answers, or type your questions and comments in the question field throughout the presentation, and we will answer these at the end of the talk, in addition to addressing the questions that were pre-submitted at registration. We do have all of those. Thank you for sending them in. If the control panel window is distracting to you, you can minimize it or drag it down to the lower right corner of your window, and then you can expand it at any time if you wish to submit a question. Now, next point is the session is being recorded, so if you have to leave early or you want to revisit any of the material presented today, you'll receive that link in email within the next day or two. And we encourage you to share it with anyone on your care team or other families that you know who weren't able to be with us today. If you're having trouble hearing or if your Wi-Fi gets glitchy, sometimes just closing out the app and restarting will get you right back on track. Okay. So if you joined us today for the Vanderbilt Kennedy Center Rett Clinic Town Hall, you've arrived at the right place. I am Paige Nues, Director of Family Empowerment at RettSyndrome.org. All of us at RettSyndrome.org want to thank you for being with us today and for your support and your engagement. We believe that information on our rare disorder should be free to all who avail themselves of it, and we thank our supporters for their shared belief. Their sponsored ed days, town halls, and webinars allow us to direct even more precious funding to our comprehensive research programs while helping you stay connected to best practices in the here and now. Our 2020 education programming is made possible through the generous support of Acadia Pharmaceuticals, Greenwich Biosciences, and Neuron Pharmaceuticals. And in today's economic environment, we are even more grateful for their support. Now, let me say that as we find ourselves today at the crossroads of so many issues competing for our attention and our resources, we felt it was time to recenter and reconnect our attention on this road that is so personal to us, that we were cast upon with our children, not because of anything we did or didn't do, but a difficult road nonetheless that can be very lonely indeed if traveled without help or hope. Rett syndrome knows no boundaries. It affects approximately 1 in 10,000 females worldwide, and even more rarely in males. Most of them never heard of it, and no parent wishes for it. However, the bright and engaging smiles and personalities of our mostly nonverbal children do envelop our hearts and minds with purpose and move us to find strength we never thought possible. All of us at RettSyndrome.org, our board of directors, our virtual team across the US, and League of Parent Volunteers are committed in partnership to offering connection, education, advocacy for all affected by Rett syndrome while investing in research and advocating for research progress. I say that as both your Director of Family Empowerment and as parent to a beautiful teenager with Rett syndrome. It's been our pleasure to partner with your team at Vanderbilt Kennedy Center for many years now for referrals, knowledgeable and compassionate clinical care, natural history study data collection efforts, clinical trials, working groups, lab efforts. They know and they care. And we were so disappointed to have to move all of our in-person events to virtual this year, but we hope that this allows many families who weren't able to travel to the Ed Day or haven't had a chance to meet the clinic team to be with us today to learn a little bit more about the strengths that this team brings to you and your family. And they're here today to bring you up to date on their activities and let you know that they didn't go dark during this pandemic. So much good progress has happened despite 2020's disruptions, and you deserve to learn about them. So your very contributions to fundraisers, family-to-family support, research participation leading up to spring 2020 enabled this great work to happen and so much more. Your continued support through the summer and the fall with virtual galas, virtual strollathons, Giving Tuesday, as well as your tremendous activity during October Rett Syndrome Awareness Month have demonstrated just how mighty and committed you are to our ongoing work, and we want to thank you. So despite all of the disruptions and hiccups, we've not given up on you or your family or lost sight of your needs, and we're here today to give you some updates. So I wanted to share a brief quote before turning our presentation over to the Vanderbilt team. And this came from a family and I think really resonates to the commitment of our foundation, the Vanderbilt team, and really probably is something that every family with us today has experienced. And let me read this real quick. Today marks 2 years since we found out A has Rett syndrome, A being their child. Before she was diagnosed, I worried about why can't she do this? When we got the diagnosis, it was she won't be able to do this. And now I try to focus on figuring out how can she do this? And I'm so proud of her for all that she has and continues to accomplish. While I still have moments of sadness and worry about what the future will bring, I'm trying to ground myself in the present because it's a good place to be. And that is the purpose of today's town hall. Because no matter where you are on your diagnostic journey, if you're new to the diagnosis, or your child is a teen, a tween, an adult, we all have these feelings that recur again and again of lost dreams. Why can't she do what we wanted her to do? And we as a team are committed to help you move to a more healthier place of, well, how can we get her to do more? How can we pull out the best development that's possible for her? And how can we get her engaged in clinical trials that may benefit her? So we hope that you join us in living in the present moment, digesting all the information of the resources that are available to you, make yourself available to them and share them with your teams to get yourself to the good place. So with that, I want to just share what our brief agenda is going to, really briefly, our agenda today, and then turn it over to the Vanderbilt Kennedy Center team to share some updates with you. We've gone through our welcome. We're going to hear from the clinic. Once the team is done with their talk, I'm going to come back and give you some of the updates from rettsyndrome.org, and then we're going to move to QA. So with that being said, I am now going to turn over the stage to Dr. Jeff Newell to kick us off. Dr. Newell, if you'd like to bring on your webcam, and Dr. Fu, everyone on the team, let's get going.
Thank you. Thank you, Paige. We really appreciate having this opportunity, and we're really grateful to rettsyndrome.org and Paige for helping put this together. And we're really grateful for all of you joining us today. So we have a little presentation. Here's a little overview. This is the welcoming, and then we're going to talk about the Rett overall Rett program, and then the clinic and some clinical research. And some trials, and then ultimately we'll deal with some questions. So first of all, I'm Jeff Newell. I'm the director of the Vanderbilt Kennedy Center, and I'm the director of the overall Rett syndrome program here at Vanderbilt, which spans between basic and translational scientists to clinical research and clinical care. Today, we're focused really on clinical research and clinical care, and maybe we'd be happy in the future ever to discuss some more of the basic and translational research. But we wanted to make this really focused on the people who have Rett syndrome and the families who are taking care of them. Can you go to the next slide, please? So I'm going to transfer now to Carey Fu, who's going to discuss about our multidisciplinary Rett syndrome clinic. Thank you. Thanks, Carey.
Thank you, Jeff. And thank you, Paige and RSO, for hosting this and helping us all get together today. Welcome to everyone. And I hope everyone had a pleasant Thanksgiving, as pleasant as can be under the circumstances. Thank you for sharing part of your Saturday with us. So let's see, as Jeff was saying, I'm Carey Fu. I'm one of the pediatric neurologists and epilepsy specialists here at Vanderbilt, and I've been here for the past 12 years now, and for the last 7 or so, I've had the privilege of getting to be part of this Rett syndrome community, and it's truly been a privilege and a pleasure, and to be part of this family, and getting to learn from your families, and that have really inspired me to not only be a better neurologist, but also I'd like to think a better person in general as well. So it's my pleasure to talk a little bit today about our the multidisciplinary clinic that we have put together here, that we're very excited about. And it's something where, in the past we've always seen kids with Rett syndrome here, but it's really been just recently that we've kind of coalesced things into a more organized fashion to be able to provide a little bit more efficient, comprehensive care. So we are entering our 3rd year as a formal clinic, so it's very exciting. Jeff and I have helped, and Sarika Peters have helped to put this together. We operate out of the pediatric neurology clinic here at Vanderbilt Children's Hospital, and so we utilize their clinical infrastructure. And so if you are calling clinic, the triage nurses that answer the phone will be part of the greater clinic structure, and but it's very convenient to have those resources to be able to build off of. Currently, we are seeing families once every other month, on the 3rd Friday, in fact, of every other month. And we actively follow around 50 patients with Rett syndrome and Rett syndrome related disorder, mostly from Middle Tennessee, but then also some from surrounding states. All right. So who we serve. So it's not just Rett syndrome, right? This is a large community. So we do, though, people of any age. So we don't set age limits. Who have a clinical diagnosis of typical or atypical Rett syndrome, and of course people who have documented mutations in the MECP2 gene who don't meet criteria for Rett syndrome, such as boys who have MECP2 encephalopathy, we will also see. And then people with the Rett-related disorders, such as MECP2 duplication syndrome, CDKL5 deficiency disorder, and then FOXG1 syndrome. And you can see here, to the right, I have, this is kind of the general catchment area of who we're currently following, where they're from. Most people are from Middle Tennessee area, but we do see people from Southern Kentucky, Western North Carolina, Northern Alabama, Mississippi, Indiana, and Ohio. And you can see that this kind of overlaps with some of the other Rett clinics out there. And so, we encourage people whenever possible to stay local, but if people are interested in traveling a little bit further, we are always happy to see families. So this, to the left here, you can see that's our clinic phone number if anybody were ever to need to call us. And for new referrals, there may be a lot of folks we're already following on the call today, but for new referrals, if your primary care provider wants to fax a request for Rett syndrome clinic specifically, that's our fax number. And then we also have, through the Vanderbilt Kennedy Center, we have a Rett program and then Rett clinic website where there is a web submission form for self-referrals, which your PCP could also use that as well. So, all right. So who are we? So we have a core set of clinicians that are regularly in clinic. So that's Jeff and I as pediatric neurologists, and then we have a speech pathologist that comes to clinic regularly, a nutritionist, and then to tie into the clinical research perspective, we also have one or the other of our clinical research coordinators, Lacey or Nicole, that will attend clinic as well, just to keep people apprised of research protocols that we may have going on at the time. And of course, clinic is not just limited to these providers. These are just the ones that are there every day, and which tends to fill up a good part of the afternoon for most people. And so when we need to, we do have a larger group of individuals that we work closely with that we can refer children to. You know, Sarika Peters as a developmental psychologist, and then Alice Lawrence, a developmental pediatrician. For the children who have GI issues, we have gastroenterologists. And then for some of the older children that have more movement disorder issues, we have access to movement disorder specialists as well. And then Dr. Mencio in orthopedic surgery, and then speech specialists who are also neurologists. And so it's not just, again, limited to the core team, but we find that it ends up being a little bit more effective to just do these other specialties on a case-by-case basis and refer separately to them. And of course, Vanderbilt, Children's Hospital as a whole, has access, we have access to multiple other subspecialties that if we need to do, such as cardiology and other specialties that we could also refer to. Those are not as frequently accessed by our patient population. So that's really all about the clinic. Of course, with the pandemic that's been going on, I think we've been getting a lot of questions about how Vanderbilt has been responding, and I'd like to think that we are responding very aggressively and appropriately for our patients to try to keep everybody safe. And so we have gone to, whenever possible, going to telehealth visits, including in Rett syndrome clinic, and this is, of course, when feasible. And so there are instances where, depending on the state you're coming from, whether or not we have a license for that state will make a difference in terms of whether we're able to do telehealth or not. And sometimes there are insurance barriers as well, and that can be something that's ascertained ahead of time. And so I think if you ever have a clinic appointment scheduled and it's not telehealth and you would like it to be, please let us know, because it's not automatically that it'll get scheduled, and so a lot of times we'll leave that up to the preference of our families, but that is an available resource. If you are coming to visit, Vanderbilt has implemented a mandatory face masking policy for all individuals that are entering hospital facilities. There are rare exceptions granted, and so that is something that can be inquired about on an individual basis. But when you come here, you'll see that everybody is going to be in masks. And providers also, to give added protection and to prevent transmission to other patients, we are also wearing eye protection as well for our clinic visits. So at all the entrances, and we've actually limited the number of entrances that people can use to enter the hospital. We do COVID-19 symptom screening and checking temperatures and the general illness symptoms, and so and then taking appropriate limitations with regards to those. And there are also limitations to the visitor policy put into place, where we ask that all families limit the caregiver accompanying your child into clinic or the hospital to one. And of course, there are also exceptions granted for that in the cases of people with more complex medical needs who may need more than one caregiver to make sure they stay safe. And so, but again, that's on a case-by-case basis. And then finally, there are in all public areas and clinic rooms, there have been enhanced sanitation protocols put into place to make sure that we're minimizing the possibility of spread on hard surfaces. All right. Next slide. Okay, so I wanted to finish off this last couple slides. I've been getting a lot of calls to submit letters of support for this program, and so for people that are not in Tennessee, your state may already have had a program like this in place, and so a lot of people may already know about this, but this is relatively new to the state of Tennessee. The Tennessee version of the Katie Beckett waiver program, and I just wanted to highlight this. And so this was recently, late last year, signed into law in Tennessee, and it just started accepting applications on November 23rd. And it's it's a competitive enrollment, and so it's important to get on board quickly if this is something families are interested in. And basically, what these Katie Beckett waiver programs do is they provide supplemental insurance coverage, a lot of times in the form of Medicaid, to individuals to children with developmental disabilities, irrespective of parental income levels. So a lot of families out there who may make too much income to qualify for Medicaid, and could potentially benefit from this. And so, but again, in Tennessee, there's a limited number of slots, and it's prioritized based on severity. And all children with Rett syndrome will be eligible for this Part B, which is a more limited package of resources, and that won't be enrolled in Medicaid, but it can provide assistance for private insurance coverage. And then also a large number could additionally qualify for Part A, where they would be eligible for Medicaid, full Medicaid coverage. And there's, this is the website to go to. There's a self-referral process online at TennCare, and it's a good idea, like a lot of the families that have been contacting me, to get the supporting documentation early on, because it's a pretty relatively fast process after that. And so whoever your primary neurologist is or developmental pediatrician that follows your daughter, go ahead, and it'd be a good idea to contact them for a diagnosis letter or a letter of support, and then the applicable clinical records. Because once your referral goes in, they will do a couple different things. So TennCare is going to make sure you don't qualify for Medicaid, and if you do, you'll get that. And then if you're not Medicaid eligible, they'll start collecting documents to complete the eligibility review for the Part B, so the lesser part, but then just to make sure to also then request a review for Part A, which is then conducted separately. But as you can see, it's a limited number of slots, and so it's important to get on board quickly. So if you haven't seen it, this will be a good idea to look into it using that website. All right, so I think that's all I had, and so I'm going to turn over the microphone to Dr. Peters, who's going to talk to us a little bit more about clinical research here that's going on in the overall clinical research team. And so thank you guys for your attention today, and I look forward to answering all the questions in the Q&A session. All right, Dr. Peters.
Thank you. So you all have already had a chance to kind of get to know Dr. Newell, and many of you know Dr. Fu already. My name is Sarika Peters. I have been at Vanderbilt just over. My first contact with Rett syndrome was actually prior to that, when I was at Baylor College of Medicine. Dr. Newell and I actually knew each other from way back then. So I am just very grateful that we've been able to put together a really nice overall program here at Vanderbilt. It's taken us some time. We're very, very grateful to all of you as families. And I think we've got a really fabulous team here. So our clinical research team, Dr. Newell, myself, and Dr. Fu are all investigators on our various research protocols. And many of you have met our research coordinators, Lacey Andrews and Nicole Thompson. Next slide. If you all have been participating in our research studies, you'll know that where we do our in-person visits is on the 9th floor of the doctor's office towers in the Children's Hospital. We have a dedicated pediatric clinical research center. Many of you have probably met Vinny and Becky. Their photos are shown right there. They are really, really wonderful research nurses. They've gotten to know our patients and families. and I think have worked very well with them and are pretty adept at making accommodations just in terms of blood draws and taking vital signs and things like that. Next slide. So I'm going to start out by talking about the natural history study, because for some of you, that may be how we first established a relationship in our natural history study. So what the natural history study has actually allowed us to do, we've been able to develop a registry of patients all over the country. We have this breadth and depth that's really a repository of a lot of information on Rett syndrome and Rett-related disorders. We've gained a better understanding of genotype-phenotype relationships. It has allowed us to develop but also refine outcome measures, which are actually now being used in clinical trials, which Dr. Newell and Lacey will be talking about a little bit later. This has also become a really important educational resource for clinicians around the country who may not be as familiar with Rett syndrome, but also for families, particularly families who are facing a first-time diagnosis of just where do I go, what do I do? And a lot of the guidelines that are out there right now are based on information that has come out of the many, many years that the natural history study has been ongoing. Dr. Newell can address this a little bit more later, but this has been ongoing, I believe, since 2003, if I'm not mistaken, in different iterations. The really nice thing about the natural history study is that it has allowed us to form collaborative relationships, but also to develop a network of clinicians and researchers who know a lot about Rett syndrome and have really great ideas of where we'd like to take the field next in terms of future research studies. And as I've already mentioned, this has been crucial, the information coming out of here in terms of the foundation for future clinical trials, because it's given us a baseline of knowledge for how the disease progresses. And that's really important, because if we are to decide whether or not a drug is effective, we have to be able to pinpoint where are we starting, and then how will we measure improvement over time. Next slide. So I gave you guys a little bit of a snapshot of the natural history study, but we will be enrolling and doing visits through July of 2021. For those of you who are already enrolled, I want to let you know that we are doing visits remotely. If you prefer not to come in person, but do want to check in for a research visit, we can arrange to do that. For those of you that are interested in new enrollment, that is still ongoing. Your kids or adults will be assessed using structured interviews, and then Dr. Newell or Dr. Fu would be doing a structured clinical assessment if they saw you in person, but there are also adaptations that we've been able to make to do some things remotely as well. Parents and caregivers, if you've been participating, you know that we ask a lot of details and get a lot of updates about new skills that have emerged since the last time we've talked, any skills that have been lost, and things that have been regained since a regression period. Below, we just have some of the details about who we are enrolling. We do require that we have a copy of genetic testing, and if it's Rett syndrome as opposed to a Rett-related disorder, we want to make sure that your child meets the consensus criteria for either typical or atypical Rett syndrome. Next slide. So this is a related study that comes out of the same core group as the natural history study. Some of you have come to our lab in the Vanderbilt Kennedy Center. Basically what this is, we are doing neurophysiology studies. You'll see in the photo there, this is not a typical EEG. This is a cap that has little soft sponges that will fit over your child's head. There will be a little bit of water that's put all over to make sure that it's fitting properly. But the reason that we're doing this is we are wanting to characterize neurophysiological biomarkers in Rett syndrome and Rett-related disorders. And basically what this does, these studies measure the brain's response to an external stimulus. For those of you whose children have participated in this, there's an auditory task where we play a series of tones, and the cap, if you will, measures the brain's response to those series of tones. And we also have a much shorter visual task where we'll ask the participant to attend to the screen. Either myself or one of our coordinators will usually be behind the screen trying to get the participant to attend. For the most part, it's actually worked really well. And we will also capture the brain's activity at rest for just about 5 minutes at a time. And you can see below, we're enrolling both males and females from a very young age up to the age of 25. And this is ongoing through July of 2021. Next slide. And we also, some of you have participated in this as well. We have a biobanking study. And basically the rationale and purpose behind this is that we know that there's a lot of clinical variation in Rett syndrome that's not entirely accounted for by, for example, mutation subtype or known biological factors. We also don't have biomarkers of disease status or clinical severity or how kids may respond to therapeutic interventions. So we are collecting biological samples, and these involve blood draws. We're collecting these from participants with Rett and Rett-related disorders, but also from unaffected family members. So a sibling, a mom, a dad, and these are for one-time visits. These are in-person visits only. And we will be enrolling through July of 2021. So I also, yes, next slide, that's fine. So I also just wanted to briefly touch on some of you that are in attendance today may have participated in a pilot study that I was doing, just looking at the efficacy and feasibility of wearable devices, kind of like this little Fitbit that I have on today. What we know is that these wearable devices provide us with a way to assess really important features of Rett syndrome in a way that's non-invasive, and it also allows us to capture data within your home, within a naturalistic environment, because we don't get to come home with you. We know there's a lot that happens within those home environments. And so this is a way for us to get more information related to skin temperature, skin conductance, variability in heart rate, and also hand motion or hand use. Through funding, generous funding from RettSyndrome.org, we completed a pilot study with, back one. There we go, with 20 participants with Rett syndrome, and used this device that you see right there. For those of you all who participated as parents or caregivers, you'll know that we also asked you to complete some little online surveys, just rating your child across a number of different domains. And what we found is we didn't have any parents or caregivers reporting problems with actually wearing the device. That was something that we were originally concerned about, but that was not a problem for anyone. What's exciting is that the results from the study showed that there was a very clear distinction in these physiological parameters when we compared periods of sleep, periods of being still versus active or awake periods during the day. And that was true for all the parameters from the device. Something that you all may also find interesting is that your ratings of your child's hand use were actually significantly correlated with ratings from the wearable device related to hand motion and hand use. We also found some correlations with ratings of clinical severity from our clinicians. So our next steps are hopefully to do some larger scale studies related to validation, where we'll have more opportunities for enrollment. And I believe that there was a question that was submitted in advance about sleep studies, and wearable devices do capture sort of periods of sleep and sleep quality, sleep duration, and things like that. So we're hopeful that we're going to get to do more with this. I am now going to turn it over to Dr. Newell, who will talk about clinical trials.
Great, and thank you. And I realized a couple things. I didn't, as Carey and Sar introduced themselves about getting into Rett syndrome. I became interested in Rett syndrome basically 20 years ago when I was in my final year of, actually 21 years ago when I was in my final years of medical school, and I was choosing where to go into child neurology, and a senior child neurologist advised me to go to Baylor and work with Houdazabi because she had just found the gene for Rett syndrome, and that's how I began this journey into Rett syndrome, going to Baylor, working with Dan Glaze in the clinic there, and Houdazabi, and doing the lab-based research. And you're right, Sar, the natural history study has been officially going on since 2004. It took a couple years to get official data collections, but we started doing traveling clinics, and I started meeting people like Paige Nues back in 2003, 2004. So we've known each other quite a long time. One other thing I'd like to tell you that we forgot to put in the general clinical research is that we also have a new study that was funded by the NIH to develop and improve an outcome measure in Rett syndrome. And it really, for the participants, it will be involving coming doing an in-person visit, but essentially just doing our standard exam that Dr. Fu or myself would do. The only difference is that we'll ask you to be videotaped so we can store those videos and be able to look at each other's ratings to make sure we're rating them the same way. It's what's called reliability. So that's, other than that, from a participant standpoint, it's just like coming in and getting a normal evaluation. So let me tell you a little bit about the clinical trials that we have going on here at Vanderbilt. The first I'll tell you about is a trial in the use of oral ketamine in people with Rett syndrome. I'm actually the IND holder and then the PI. This is a multi-site study. It's funded by a foundation, the Rett Syndrome Research Trust. Previous work in animals has shown that ketamine can improve features in the Rett syndrome mice. And so we're looking at a short amount of time on the drug, oral ketamine. It is a double-blind study, meaning that you either are on drug or not, but it's also a crossover study. So actually everybody who participates will be on the drug at one point. We just don't know if you're on the drug first or on the drug second. So the overall amount of time is about 4 weeks, with a week before and a week after. So overall it's about 6 weeks, but really there's a center period of about a month that involves some study visits. We're trying to enroll 48 people. It's for people who have Rett syndrome and a MECP2 mutation, and it's from 6 to 17 years old. Now, one thing, and this came up, and I'll come back to this later, a lot of the studies that go on, you have to have typical or classic Rett syndrome. In this study, you can have atypical Rett syndrome. So you can actually have some of the people who are higher functioning or much, much lower functioning actually can participate in this study too. This is mostly to look for safety, but we're also looking to see if there's any signs of efficacy. And we are using these sort of biosensors, a wearable device. We're actually measuring breathing at home. We're measuring activity at home. So we're really interested in pushing this forward, and happy to talk to any of you about that if you're interested. Next slide, please. The other trial, which is a very large trial, and I'm not the IND holder, so this is a mistake on this slide, but I'm the PI for our site PI for trofinetide, which is something a lot of people have heard about in the past. It was previously called NNZ 2556, but the drug name is trofinetide. So we've already done 2 clinical trials called phase 2 trials with this drug, which showed efficacy in both adults and in children. And now this is a large multi-site study of this drug across the country. It is a double-blind placebo control. So in this case, what it means by double-blind is that the investigators here don't know if you're on the drug or the placebo, and you don't know. So it's kept, that sort of prevents us having bias. This is being on 12 weeks on the experimental compound, either trofinetide or placebo. And then afterwards, there's an opportunity to be what's called an open label extension, which is a different protocol, but it follows onto this. And in an open label extension, everybody's on the drug, and we all know it. So this is for people who have Rett syndrome, and in this case, it has to have typical Rett syndrome, or classic, and a MECP2 mutation. It's down to 5 years and up to 20 years old. You have to be over 12 kilograms, and you have to be stable on medications and the therapies that might be being done over the time before and after during the trial. And this really is trying to look for efficacy. This is called a phase 3 trial. So this is where the company is really trying to prove that it really works and get the FDA to approve this compound. So again, we are actively recruiting people into this. We're very eager. We and the sponsor and all the other sites are very eager to complete this trial sometime next year, and try to get the answer to know if it's going to work or not. Next slide, please. So we introduced the clinical coordinators already a little bit, but let me just put it up here. We have 2 excellent clinical coordinators, Nicole Thompson, who is unable to join us today because she's on vacation, but here's her contact info, and Lacey Andrews, who's been with us, what now, 1.5 years, almost 2 years, is really the point person for the clinical trials. And here's Lacey's contact info, and I'm actually going to turn it over to Lacey at this point, because I think she's going to cover just some general info and discuss some of the facts, some various questions that we oftentimes receive about clinical trials.
Thank you, Dr. Newell, and hello, everyone. My name is Lacey Andrews. I came to Vanderbilt almost 1.5 years, almost 2 years ago, and that was my first experience with working with Rett syndrome and in the families here. And I've had just the warmest welcome. I've been a pediatric clinical trial coordinator for almost 5 years now, and it has been an absolute pleasure working with this team and our families and everyone involved. Today, I would like to answer some of the most frequently asked questions we get when we are talking to families about research. Probably the most asked question is, can my child enroll in more than one research study at a time? This answer depends on what type of research study. By and large, research studies fall into 1 or 2 main categories, those with an intervention, such as a treatment or a therapy. And with interventional trials, such as the ketamine and the trofinetide trial that Dr. Newell just described, you can only participate in one of those at a time. So if you're enrolled in ketamine, you would have to finish ketamine before you can enroll in the trofinetide trial. The other type of research study that we do are observational trials. So those are trials in which we're watching behaviors. We're looking at reactions to a task that's been given, and we can also take samples during these studies as well. So those would be like the Iep study, the natural history study, and the biobanking study that Dr. Peters described earlier. With observational trials, by and large, you can participate in more than one of those at a time. So if you wanted to participate in all 3 of the Iep, the biobanking, and the natural history study, that's a possibility. You also have the option to kind of intermix the 2. So if you're participating in ketamine, which is an interventional study, you can also participate in observational studies, such as the natural history study. It's a lot of information to kind of throw into answering one question. By and large, it depends on the type of study that you're participating in, but it's also going to depend on each individual study and the rules that apply to those studies. But these are the details that your clinical coordinator are there to help you navigate through. Are there limits to how many people that can enroll in one particular clinical trial? Yes. The number of people needed to participate in a clinical trial is determined before the trial starts. And then once we start enrolling, once you meet that number that's expected, all of the sites around the country that are participating in the trial and actively enrolling are notified that that number has been reached, and they will stop enrolling at that time. I don't live in Tennessee. Can you see my child? Absolutely. This goes for research studies and for clinic visits. And we try to make, if you're traveling to us, we try to make it as convenient as possible, and we'll try to schedule as many activities in one day as we can. We do ask that if your child is seen somewhere else, you send your child's records to us so we can get a more thorough background before your appointment. Do I have to enroll in research to have a clinic visit or vice versa? Absolutely not. We see patients and families for clinic visits only. We see families and participants for research visit only, and then we see families that participate in both. Again, we try to make it as convenient as possible. If you're coming to us for clinic and you have a research visit, we'll try to schedule those in the same day if it's feasible and if it's realistic. If not, we'll try to schedule them pretty close together so there's not a lot of travel back and forth. So those are some of the most frequently asked questions that we have. I think at this time, our team would like to move into the Q&A section and answer some more questions that were submitted previously and during our talk. So I'm going to turn it back over to Dr. Newell so we can start answering some of those questions for you guys.
Great, and I don't remember. Okay, we just had this for right here. Okay, and I have some of the questions that were submitted beforehand, and people can type things into the chat box, and we can keep track of them. I've sort of combined these questions. There were some themes and recurrent questions, so I sort of grouped them together. So I'm going to first talk a bit about some of the questions that came up that are related to clinical trials, and then we'll talk about some more things that more relate to clinical care. And I probably will turn it over and call on other members of the team to answer some of the specific things. But let me start with the trial questions. One of the questions that a lot of people have been interested in and wondering about is gene therapy trials. A company called Avexis that was bought by Novartis had announced a couple of years ago that they're going to do gene therapy trials in Rett syndrome, and they had previously said that the trials were going to start this year. They are not starting this year. There was a variety of things that went on with the company after they were bought by Novartis, and they went back and have been they pulled what's called their IND, which is investigational new drug application to the FDA for that, and they reworked it and basically are in the process of resubmitting that for Rett, or they submitted it this fall. I don't think it's quite submitted yet, but because we would hear it in a press release. But as far as I understand, they're still on board and moving forward, and hopefully, let's keep our fingers crossed to see that kind of movement and activity in the next year. Another company actually had recently been formed outside of Dallas called Taysha, and they've also said that they would be they're interested in developing gene therapies in Rett syndrome. So there may be a couple different things. Now, that said, there are some questions about is this, Chris, people would like to know, will this really be effective? Will it be safe, of course? And, of course, the ability for it to be effective is an unknown. That's why we do these clinical trials. We're trying to figure these things out. There is evidence from animal work that gene therapy can be effective, but this has to be done in people before we'll really know. These are becoming more complicated and advanced biological therapies, and so there are issues associated with them and risks. Luckily, things with gene therapy generally have gotten much, much safer. The Avexis had great success with a gene therapy for a severe neuromuscular condition, childhood neuromuscular condition called spinal muscular atrophy, that it does seem to be pretty safe, and it's really made a big impact on those severely affected individuals. However, we have to see how it'll work in Rett syndrome. Second of all, there is always the underlying risk when you add back a gene like MECP2 that we know is tightly controlled, and that if you have too much of it, it can cause a problem like the MECP2 duplication syndrome. So that's going to be a significant issue to make sure we're not doing that overshooting. But I think that these are avenues that have potential and are very interesting and intriguing. Along that, another question that somebody asked about brought in another sort of concept in advanced biological-based therapies called Crispr. Crispr has been in the news a lot. It's a method to do targeted genetic engineering. So instead of the concept of, like, saying adding back with a virus the gene, a version of MECP2 that would be expressed, in this case, the idea would be that you'd be able to use these technologies to go in and precisely correct the genetic change, the mutation that exists. Now, there is a lot of interest in this. Nobel Prize actually was just recently awarded for this, the development of these technologies. And they are doing some of these things in some trials, probably, I think, in Japan for eye disorders. There is a lot of issues moving this sort of editing, permanently editing in the genome, especially in sort of in your brain, and neurons that don't regenerate. They're not growing. You're not getting more neurons. And there's risks that you may edit. Might also cause other mutations across the genome. So while it is promising, there's a lot of concerns. Now, that said, there is ways to do, instead of permanently changing the genetic code in the DNA, there are ways of using these CRISPR systems to, instead of changing the DNA, change the RNA. The RNA is sort of like the copy. You have the DNA, which is like the information. The RNA copies that information and takes it and makes it into a protein. So instead of changing it permanently at the DNA level, you can make this genetic change at the RNA level, which is constantly being made. And so you're not permanently changing anything, you're just changing the messenger in between. And there is a lot of interest, I know, in this space to do that. I would say that these sort of more advanced biological therapies are further down the line, though. I mean, meaning they're not as ready for prime time. It's going to take longer to see those things get into clinical trials, but there is a lot of interest in that and other sort of advanced biological methods. So some of the other things is more about trial eligibility. So are there trials for children under 5 years old, trials for people over 18-year-old? So, the under 5, currently we don't have any trials. We had a trial for cannabidiol, but the company decided very recently to stop the entire worldwide trial, and it really was because of COVID and difficulty recruiting and moving forward with that trial. That had gone down to 2 years old. So unfortunately, we currently don't have any, but again, as we move forward in some of these more advanced biologically based therapies, we may see the age range go down younger. Now, for people over 18, as we mentioned, the trofinetide trial, you're eligible to be in that trial from 18 to 20, up to 20 years old when you enroll. So that is a possibility. Currently, the trofinetide trial is not enrolling people over 20. However, another company called Anavex that is evaluating a drug that had shown promise in animal models with Rett syndrome is enrolling older individuals. We are not participating in that trial, but I think University of Alabama, Birmingham is, and other sites around the country. So that is an option for people that are looking to be part of trials for adult women with Rett syndrome. The other was the question about trials for higher functioning girls. So again, that I mentioned with the ketamine trial, since it's not only restricted to classic or typical Rett syndrome, you have atypical, which oftentimes incorporates people who are much higher functioning that wouldn't meet the criteria for typical Rett syndrome. So the ketamine trial is able to, people are able to participate. And again, I'll just emphasize, we are doing this ketamine trial. We're very interested in moving forward. And compared to the overall amount of activities and burden on the families, the ketamine trial is far, far, far lower than some of these other trials, which are much longer and involve much more intensive evaluation. The ketamine trial is a relatively short trial, and really you're only on the drug for about 5 days. Then the other question was, what about trials for boys? Currently, we do not have any. Well, we don't have any trials currently. Again, the cannabidiol would have was including boys with MECP2 mutations and boys with Rett syndrome. Currently, we don't have any. But I am always encouraging the sponsors and stuff to consider this. I think this is a great need. I think it's an underserved population, and we need to be trying to develop therapies for the boys who have MECP2 mutations. So that's what I have for the trial. Now, we have a number of clinical questions. So can we have maybe Carey and maybe even Sar join us? So the first question was, is there a way to tell how severe my recently diagnosed child will be? So I'll take this question to start. We've done a lot in the past through the natural history study with what's called genotype-phenotype relationships, and we've been able to show that there's common mutations that cause Rett syndrome, mutations in MECP2, and we can show that those mutations are more associated with, as a group, some mutations seem to be more associated with more severe clinical features, and other mutations are associated with more mild features. However, I always recommend people to realize that this is a group property, not an individual property. It's when we talk about that, we say, oh, you have this mutation, it's a severe mutation. That doesn't mean your child is severe or mild. It means overall, but within those groups, there's always people who have the severe mutation who are very mildly affected, and people who are mild and who have a very severe situation. So it's really not, we can't really make that prediction. Second of all, when you first get the diagnosis, lots of things, if it's a young child, lots of things are changing, right? And we don't really know what all the problems might be. We know what the problems could be, and so we always sort of advise, and we're looking and discussing what problems could be. But it's not something that we know immediately. We don't know for a given individual when they're 2 years old how bad their seizures are going to be, and so we have to sort of watch this over time. And as children grow and develop more symptoms or problems, or don't, we get a better sense of what the course is. But it's always not, it's never precise, it's never exact. So that's why we're always asking and discussing and keeping track of, and not letting things go. So that's what I'd say about that. So Carey, I'm going to turn a question over to you, which relates to seizures. The question was, what is the effect of puberty on seizure?
Yeah, that's an excellent question, and it's actually one I get quite a bit in clinic. It's something that observationally has been studied a lot overall, and just the overall population of individuals with epilepsy, and a little bit in children with Rett syndrome, and a little bit like the mutations. It's a little bit of it's kind of individual dependent. On a whole, on average, we don't actually see that, like if you average it all out, there's not that much of an impact of puberty. Obviously, the concern is there going to be a worsening of seizures? And actually, some girls actually have some improvement in their epilepsy. Some seizures will go away actually after you get through puberty, but then some others will actually see new seizure types appear, when puberty starts, as you go through puberty, and may get a little bit more difficult control during that time, but then balance out afterwards. And I think what's important to remember, though, is that you think of it as kind of a phase, and what we find is that puberty is not sufficient to force an individual into developing epilepsy. Most girls with Rett syndrome who develop epilepsy, it's going to happen between the ages of 4 to 12, but it's going to be before the time of puberty, and so it's really more of the temporary influences when you have a lot of hormonal fluctuations as puberty is kind of getting established, where you'll see some loss of control, and then once things level out and periods are happening regularly, and you get beyond that point, then things will tend to stabilize again. But of course, it's very individual dependent, and I think it's something where at the time it's important to talk with your treating epileptologist about, neurologist about, in terms of whether or not certain medications need to be adjusted. There are certain times where girls will have a change in the occurrence of their seizure, so that overall it's the same number, but they may start to cluster around the period time, either right before or during, and then there are certain specific medications that might be applicable if that's the case. And so hopefully that addresses the question for people that posed it. And again,
yeah, I'm glad you extended it, not just about the puberty, but just talking about the relation with the menstrual cycle, beyond just going through puberty, because I know we do see, it's not uncommon, not just in Rett syndrome, generally in epilepsies, that there may be fluctuations depending on the menstrual cycle, and that may raise concerns to people, but that's not really quite a Rett thing as much as an epilepsy thing, right? If you start seeing those patterns.
Yeah.
Okay, great. And so how about this, Carey? One question was opportunities for virtual visits or house visits, but you mentioned already about that, how we are doing virtual clinic visits, and we also are doing virtual natural history study visits for people who can't make it here. But how about this? There was a question of what is the benefit of having an adult woman seen in the Rett clinic?
I think it's an excellent question, and I personally think there is a lot of benefit, because it is a unique, we're a part of a unique population of individuals, and there are specifics regarding Rett syndrome that will impact an adult woman differently than a typically developing adult woman. And I think to be able to see someone, a physician that has specific expertise in how the differences of how Rett syndrome impacts an individual in adult life, I think just having that as an available resource that can potentially partner with somebody's regular internist or private primary care physician, that can provide again additional advice on things like earlier development of osteoporosis and kind of the movement disorder abnormalities that occur in older individuals with Rett syndrome, as far as the increasing in tone and difficulty with just initiating movement, almost like a Parkinsonian feature. And so I think having somebody who is again knowledgeable about those new developments, I think can be very beneficial long term for care.
Yeah, and I think that's exactly right. I mean, from my perspective, I think that Rett syndrome is a rare disease, and there's not many people who have seen people with Rett syndrome anyway, and adults with Rett syndrome are even not as well understood or known. All three of us have seen many people who are adults with Rett syndrome, and we have a sense about, we don't know as much, it is true, about people with adults with Rett syndrome as children, like from the natural history study. Even though we have a significant number of people who are adults, far more we have who are information about who are children. But we do, I think, collectively as a team, have a sense about what is within the spectrum of things that might be Rett syndrome related, or how things progress, versus things that are not Rett syndrome related or not. And I think that especially if you're seeing a general care provider taking care of adults, they might, I oftentimes see general providers who are not as experienced will often just want to say, oh, that I don't know what it is. Maybe it's just Rett syndrome. Rett, everything's just Rett syndrome. And so it's helpful. We have a little more knowledge of what is Rett syndrome and what isn't Rett syndrome. But I think, one of the things too, I always think about with adult care is very important to remember that people with Rett syndrome are people, and they have people problems. They may have issues related to Rett syndrome, but they have people problems too. All kinds of people, like everybody else, has people problems. And so, because I think that sometimes general care providers, not because they're not caring or willing to think, but they get blinded by the Rett and start not thinking about just general health maintenance, right? Making sure, when you've got a woman who's now, getting older, 35, 40, 45 years old, they need to start thinking about things like breast cancer screening. And for all people, you have to start thinking about, colon cancer screening, and that these are still things that need to be thought of for people with Rett syndrome. So sometimes as an adult coming to see us, it's not that we're going to do those breast cancer screenings, but we might remind you and remind your primary care doctor, you still need to be thinking about those things. You don't get a free pass from other problems just because you got Rett syndrome. Okay, so that's great. Yeah.
Dr. Newell, before we move on, just to add on to what you were saying, is that depression and anxiety and mental health issues are also very real in Rett syndrome. And so I know that those are questions that all three of us have gotten. And just as you were saying, in terms of general physical health, how things sometimes get glossed over, I think mental health does as well.
Yep, absolutely. So here's a question that's really for both Carey and for SAR. So what are specific therapies that would be recommended for Rett syndrome? What would be, recommended approaches to be considering for therapies? I'm thinking, when I saw this question, I was thinking more along the lines of like associate, not medical therapies, non-medical therapies, but.
Sarah, I'll let you take it.
Sure, yeah, so I think probably most of the families that are in attendance here, that this will sound very, very familiar to you, but obviously speech therapy is really, really critical. I feel like we have learned so much more about Rett syndrome and about the way that our patients think through the use of communication devices. And there are now ways that that they're able to answer our questions that I never would have thought possible, even 10 years ago. So obviously speech therapy is really important.
Can you just speak a little bit about that? I mean, it's speech therapy. Are they teaching our children to talk, or what is the approach that's best to be used for this?
Sure. So speech therapy, the goal obviously is not to teach your child to speak verbally, but there is this whole aspect of language that involves nonverbal communication. And we've learned through our studies and through studies all over the world on Rett syndrome. In fact, there are communication guidelines now that have been developed. They're on the rettsyndrome.org website. But girls with Rett syndrome are really adept at using various aspects of nonverbal communication. That can include eye gaze. That can include the use of an assistive technology device. That can include vocalizations and also even a gesture. And so there are many nuances to communication that also tie into behavior and other aspects of functioning. So we also know that the more that our patients are understood, the more validated that they feel, and they're going to function better overall. And I think that that's also a key when we're talking about potential therapies in school-based environments. conventional, as a psychologist, I can say this for any of you that have sent me questions individually asking what should a school do. We know that our conventional assessment measures don't work very well in Rett syndrome. And so, we have suggested modifications to those where possible for the specific purposes of formulating IEP goals that are just more targeted and beneficial for your specific child. So in addition to speech therapy, obviously occupational and physical therapy are quite important as well, and as well as school-based supports. And the way that school-based supports look can be very different depending upon where you live and depending upon the individual needs of your child.
Yeah, that's great. And I really wanted you to go into that more about, about the speech therapy. There's speech therapists, are trained generally in speech therapy and are trained to use these assistive and augmentative technologies, but different speech therapists have different expertise and skills within that domain. The people that we incorporate into our clinic are specifically experts in the use of augmentative and assistive technologies. But I always, counsel families when they're finding local therapists that they need to explore the therapist's experience and understanding of those kind of approaches, because that's where you'll maximize the overall effectiveness. And as Sar mentioned, physical therapy primarily oftentimes being working on standing, walking, and occupational therapy that might be helping with hand function. And also chewing and swallowing. Oftentimes the occupational therapist or the speech therapist are critical in evaluating and providing guidance on how to modify diets so that you reduce choking and gagging. Okay, sorry, you sort of we're almost at the end of the questions that were sent in. You sort of hit a little bit, but I think one is exactly this about, is there resources or advice for therapists, like speech therapists, to learn more about Rett syndrome and to treat our girls? And I think that, we, try to provide counsel, and then you made a great recommendation about information that was developed with rettsyndrome.org support and is found on the rettsyndrome.org website, the general guidelines on communication. And I think that, that can probably cycle back a lot to Paige, because I think that's a great, resource. But I know that we will work with it. The other was education for school districts. And I think, Sar, you said that in the past you've had experience going, working with some of the school districts doing remote things. So if you'd speak a little bit about that.
Sure. Yeah. There was a school district here actually where the principal reached out to us. They were not familiar with Rett syndrome. They had never had another student before, and I was actually really excited. I was on a call very much like this with the entire care team, and we just did a question and answer. I arranged to meet the principal after that as a follow-up, and gave them a copy of the Rett syndrome handbook. They had some more specific and targeted questions about the student that they were going to be serving, but also just some very general questions about Rett syndrome and things like, positional changes through the day and if she's doing this, how do we respond? So as a very generic answer to that question, yes, we are happy to consult with schools. I know Dr. Fu and I have also written, and Dr. Newell has as well, have written letters of support for services in different settings, and specifically for school services as well.
Great. All right. Well, there's a few other questions that were here, but I'm going to leave those really for more something that we can talk about at the end, especially with Paige and with rettsyndrome.org, because they actually are about advice on long-term care and how to start a group home. And I think that that's that's a bigger question than just from us. I mean, I think the concept of starting a group home, I think that's where it's really helpful to have a community and a patient advocacy organization to help think about that. And the other was overall aspects about questions about the relationship with COVID and people with Rett syndrome, and what has the experience has been. And I think that that's another one that Paige has a broader network and interaction of people across the country, so I think she can speak more to it. So I think we'll end this component now. We'll be available. We're going to be around, and we're going to come back to more broad questions, so we can answer questions at the end. But I guess we'll shift back to giving control back to Paige and the team.
Great. Thank you all. That was a phenomenal presentation, and we are so grateful for all the work that you do both in your clinic and that you do as consultants in schools and the community and helping everybody. And thanks for the extensive research that you conduct at the Kennedy Center and with partners around the country and around the world. I do have some more updates to share from rettsyndrome.org. I said at the beginning that we've been very busy over the summer, and quite a few things came into production. Dr. Dominique Prashard, who is our Chief Science Officer, was unable to be with us today. Not only is she a recognized researcher at the NIH who was working on a rare disease prior to joining rettsyndrome.org, but she also has a beautiful child with Rett syndrome, and today is her birthday. So she is where she needs to be, but she sent us a video message to share with you with a little bit of an update on our research strategy and some of the things, some of the tools that are available to you to connect with the research that Dr. Newell and team shared. So let me play this video from her. And then I'd like to invite Jamie Patrick, who is a parent, a volunteer, and our rettsyndrome.org Tennessee State Representative, to come on and share with you some resources that'll help you in your community, especially the agencies and advocacy organizations that are very active during the pandemic to help you with IEPs and other resources like getting equipment and things that could feel disrupted at this time. So give me a moment here. I'm going to pull up this video and get started.
Paige, I can't hear anything.
Today, we have a phase 3 clinical trial. This is the last study needed before a company can go to the FDA to request approval of a drug, which would mean a drug would be available in the pharmacy or a hospital with a prescription. This is the first time in the history of Rett syndrome that we are able to talk about a day where we might be able to go to the pharmacy to pick up a prescription for Rett syndrome, not just for the many medical issues that Rett syndrome causes, but for Rett syndrome. We also have a pharma-sponsored phase 2 trial that just completed enrollment, for which we are waiting on results, as well as 2 additional non-pharma sponsored trials. Many of you have heard that there are also 2 gene therapy trials in development with an anticipated start time in the next 1 to 2 years. Now, I do want to put a caveat on this timeline because neither of these companies have yet gone to the FDA specifically asking permission for the clinical trial that they want to start, which means there may be changes to this timeline. There may be more things they need to do before the FDA provides permission for them to initiate a clinical trial. But there is hope now that in the next 1 to 2 years, 1 or 2 of these gene therapy companies will be able to bring a clinical trial for Rett syndrome. Not only has rettsyndrome.org invested in clinical trial development, but we've also changed the landscape by investing in the research that can impact your family now. Today, we have our first ever primary care guidelines. These guidelines are available on our website and available in the medical literature. These guidelines are so that the doctor or team of doctors that take care of your sons and daughters know the standard of care of a child or adult living with Rett syndrome to ensure optimal clinical care. Today, we have the first ever communication guidelines so that your son or daughter's team can develop a strong functional communication plan that allows your son or daughter to have a level of independence in how they interact with the world. So often, the world happens to our children, but a functional communication plan puts them in the driver's seat and lets them interact with their world in a much more meaningful way. We believe that transformative or curative therapies are in the future. We believe that there will be a day when we don't recognize Rett syndrome as we do today because the treatments have changed the course of the disorder. We're committed to funding innovation, to bring solutions forward, and to have the delivery mechanisms, clinical trial readiness in place to make these innovations a reality. In Rett syndrome, we as a community are very fortunate to have multiple groups investing in Rett syndrome biomedical research. This research is extraordinarily expensive, costing billions of dollars to make lab discoveries and actually bring them all the way through to the clinic. But Rett syndrome is now on the map. US government agencies such as the NIH and the Department of Defense, as well as international governments, are funding research in Rett syndrome. Our colleagues at Rett Syndrome Research Trust are funding work in Rett syndrome. Local Rett syndrome associations are also funding work in Rett syndrome. We need all of it, yet it's still not enough. I work closely with government agencies advocating for more funding in areas that will specifically benefit Rett syndrome. This year, I was invited to be a member of an NIH strategic plan working group that was charged with identifying key priorities for the National Institutes of Neurologic Disorders and Stroke to fund over the next 5 years. I had a seat at the table advocating for NIH to fund the type of work that Rett syndrome science needs to get us to the next level. I advocate on your behalf so our dollars can go further. But as I said, we need all of the funding, and each funding group has its own philosophies and priorities. So I'm here to share rettsyndrome.org's priorities. We invest in the solutions from the lab science that makes breakthrough discoveries to the clinic network that is needed to deliver those breakthrough discoveries. Both parts are critical to our joint mission of treatments and curative therapies for Rett syndrome. I am unwavering in my mission to excel in both areas. So how are we doing that? We're continuously scanning the neuroscience, brain, drug development, cell and gene therapy industries to identify science to fund. Science generated from known Rett syndrome researchers and science from other fields that stands to benefit Rett syndrome. Science that will move the field forward toward our mission of bringing treatments to your sons and daughters. We formed a scientific advisory board, and this group of world-renowned experts is guiding us in this plan. We are clear in our vision for funding science that happens in the labs. All strategies must be tied to identifying new treatment options, be it a therapy that allows your son or daughter to have an improved quality of life, or a therapy that has the potential to be transformative for your son or daughter in the future. This includes discoveries that identify a path to a treatment and ways to identify prospective drugs in those pathways, to testing those promising candidates in the animal models. We are here to de-risk the process so pharma and biotech will continue to engage and find Rett syndrome an attractive disorder to invest in. A not so unknown fact is that pharmaceutical companies want to invest in disorders where they will win, and clinical trial readiness is a huge part of that equation. So what are the components of clinical trial readiness? Clinical trial readiness means having a network of centers with enough expertise in the disorder to carry out a clinical trial and clinical research infrastructure to successfully conduct those clinical trials. Clinical trial readiness means having tools to measure success. In a clinical trial, outcome measures are biomarkers that indicate therapeutic improved how someone feels, functions, or survives. Clinical trial readiness means a patient community that is willing to participate in clinical trials. A good way to scare away pharmaceutical companies is to have clinical trials fail because not enough people enroll in the study and they have to close it down early. It's like sending a message to other pharmaceutical companies to run away, because for pharma, time equals money. The longer it takes to enroll for their clinical trial, the more money it costs. So you, the patient community, are a vital part of clinical trial readiness. So what are we at rettsyndrome.org doing to support clinical trial readiness? For the clinic network, we have a newly formed medical advisory board, which really formalized an informal network of physicians that have been advising us. And this medical advisory board is consisting of leaders in the field. They are guiding us in the process of developing Center of Excellence designations for Rett clinics meeting high standards we all want for the care of our loved ones. This group of centers of excellence will be ready to be the delivery mechanism of the great breakthroughs we are investing in. Next, those tools to measure the success, the outcome measures and the biomarkers. This will always be a work in progress. We do have tools today, but we need better tools. We're engaging researchers, pharmaceutical companies and biotech, the FDA, and families, all key stakeholders of the discussions. The tool used in the clinical trials will depend on what treatment is expected to do. And as we know, if you know one person with Rett syndrome, you only know one person with Rett syndrome. There's so much variability. And so the tool needs to be able to detect meaningful change through all this variability, which is no easy feat. But we are ready to tackle this. And lastly, the community. I hope you have had a chance to get to know our Rett Research Ready program. This tool is a natural strategic extension of our research investments. Rett Research Ready is a program to educate you, a parent or a caregiver of a girl or boy with Rett syndrome, so you feel empowered to make an educated, informed decision about whether participating in a clinical trial is right for you and your family. I was recently speaking with one of our Rett clinic directors, introducing her to the Rett Research Ready program, and she shared that this is one of the most powerful tools we could equip our families with. Vetted, accurate information about what clinical trials are, what it means to participate in clinical trials, and what to expect during and after a clinical trial. As well, it has a one-stop shop to see all of the clinical trials being conducted in the US, regardless of who is sponsoring the trial. This is a tool for all. And for those families who decide participating in a clinical trial is not for them, or families who have a son or daughter who's not eligible to participate in an active ongoing clinical trial, but they still want to contribute to the research, there are other research opportunities listed in the Rett Research Ready program that you can do from the comfort of your home. This includes surveys that researchers are conducting or studies that are conducted through telehealth visits. Everyone can contribute to the research if they want. Importantly, we are getting our community Rett Research Ready. At rettsyndrome.org, we're committed to growing clinical trial readiness in our entire community so that we are an attractive disorder to pharma and biotech, so that those breakthrough discoveries that are being made in the lab can turn into success stories. I hope that over the last 10 minutes, you've taken a trip with me that leaves you inspired and excited about the future in Rett syndrome. And you know what rettsyndrome.org is doing to move the needle. We are all in this together. We all do our small part to make a big difference. And together, as a unified community, we will advance towards a world without Rett syndrome.
All right, thank you. I hope you all enjoyed hearing a little bit from Dr. Dominique Prashard, and I hope that you'll have a chance to meet her in person at any of our future events, which we will get back to as soon as we're allowed. I want to introduce you to Jamie Patrick, who is your RettSyndrome.org Tennessee State Rep. While Jamie is getting herself ready, I would like to just highlight some of the research opportunities that you can find in the My Rett Research Ready Trial Finder tool that anybody can take part of virtually. These are surveys. One is specifically happening right in Tennessee. It's the University of Tennessee, and it's a retrospective study examining the differences in vocalizations of babies and toddlers with Rett syndrome compared to same age peers. And studies like this will help us identify in making earlier and earlier diagnoses. So that is something, again, that your local community is doing. So take a look at the My Trial Finder, and you can find that on rettsyndrome.org. And keep participating if you can. As Dr. Prashard said, and Dr. Newell said, that we can hope, wish, and dream for research to become a reality, but unless we meet our researchers where they are and let them talk to us, learn from us, and work with our children, we're never going to get there. So for those of you who have participated already, thanks for being trailblazers. On the family empowerment side of our mission, we have a lot of materials that are available to you. Most of you should be familiar with these materials. If you're new to our organization, to our community, our newly diagnosed family, please spend time on our website and sign up for our newsletters, join the social media forums, make yourself some awareness cards. This is the best way when you are out in your community and someone asks about your child and what they have. Rett syndrome is kind of hard to give, a quick answer to and describe what it is. But if you have a card that has your child's picture on it and a little description of Rett syndrome, you can hand it off to them and you've educated someone, and that empowers the world to know more about our rare disease. I wanted to just make sure that everybody knows about our digital library. So, for example, as Dr. Fu talked about the influence of puberty on epilepsy, we have an entire recording done by Jane Lane that talks about puberty and what that means in our children with Rett syndrome. So how to manage periods, how to manage the things that happen typically for people as we grow and develop, happen in our children too. We also have recordings on adulthood. So if we don't get to that question, we have an entire hour about transition to adulthood and some living options that have worked for other families. It's a recording where we have a couple of different families who have set up different things in their communities, from a care home, a residential center, to keeping their child at home while they became empty nesters with their other kids. And I think by learning through other families how they have survived and thrived on the journey of Rett syndrome across the decades, it will empower you to not be so afraid of the future and to set yourself up for success as well. Okay, so I also wanted to mention, and I can't believe that here we are in November, it's actually December, not a surprise to me that we're still dealing with COVID and the pandemic. In March, we responded very quickly to the situation that many of ourselves found ourselves in, being quickly at home without our usual therapies, schools, which also translated to not having access to a lot of the equipment that were in those centers that enabled our kids to have continuity in therapy. And what we did was we gathered some of our therapists worldwide to do live Facebook live feeds via Zoom into different people's homes to show how you could use the equipment at home that you have, a couch, a wall, a yoga ball, any kinds of things to help your small child, your teenager, your adult have continuity of care. Since most of our work is still done via telehealth, I encourage you to go to our website, rettsyndrome.org, COVID-19 resources. Those recordings are still very relevant, and take a look at them. Very practical guides on how to do communication and therapies. And also check our website for periodic updates about the progression of Rett syndrome and how we as a community are dealing with it and coping in the time of COVID. Dr. Tim Benke is our medical advisor. The updates that he writes are in consult with everybody on the network, including your team at Vanderbilt. And again, we have monthly webcasts. Next week, December 8th, we're going to be talking about a topic that we discuss a lot in CDKL5, which is cortical visual impairment, and we don't talk enough about it in Rett syndrome. So Tristan Dinkel from the University of Colorado Rett Clinic is going to give us a presentation on what do we see and vision in Rett syndrome. So these are all free. Again, thanks to our sponsors, we can make them available to you. Go ahead and sign up and join us again on Sunday. Now, what I'd like to do is conclude our presentations by letting Jamie introduce herself. Tell us a little bit about your family, Jamie, and the joy that you get by helping others in Tennessee. And we know we have many families with us who are not in the state of Tennessee, but these are just examples of what we have in Tennessee. You can also go to our website and find the rep in your state and the resources available in your state. So I'm going to stop now, Jamie, and let you get started. Thanks for being with us today.
Thank you. Well, first off, I want to thank everybody. I want to thank Dr. Peters, Dr. Fu, Dr. Newell, everybody at rettsyndrome.org for putting today together. As a parent, I really appreciate the time that went in today. It's very important to me, and all the information is very helpful. So I wanted to thank you all for your time. My name is Jamie. I am a mom to a 7-year-old little girl with Rett syndrome. Her name is Savannah. I am also the volunteer for rettsyndrome.org on the state rep for Tennessee. My daughter participates in a drug trial at Vanderbilt, and she's also part of the Natural History Study. So we are pretty close to the team there at Vanderbilt. We have enjoyed getting to know everybody there. I want to welcome you, just as a state rep, I want to welcome anyone to, my email is there on the screen, my phone number is there as well. You can look me up on Facebook, message me, text message me. If you ever have questions or something going on, please feel free to contact me. That's one of the reasons that I put my information out there, is so that families can have a place to go if they have any needs. Hopefully I can point you in the right direction. One of the biggest things as a mom that I have figured out as a mom with a child with Rett syndrome is that you don't always have to reinvent the wheel. And so hopefully just using your resources and contacting the people out there that are going through it and that have been through it, that's a great way to just get through some of the harder times that I know people are going through right now, especially with COVID. Another thing that I wanted to point out was that Tennessee, we also have a page for the Rett families that have family members with Rett syndrome. We have a page on Facebook that you can join. There's a link there. There also is another page on Facebook that you can join. It's called the Rett Syndrome Family Support Forum. Either one of those pages, they're both very, very helpful. They have a lot of tools. You can always ask questions. As I stated earlier, you don't have to always reinvent the wheel. If you ask for help, there's always someone out there that has great ideas and that can help you. Another suggestion right now especially is making sure that you get to know your Rett clinic team, getting to know your therapy team, your team at school. There are several different ways to do that. Teaching them how your child communicates. One of the ways, my daughter's name is Savannah, one of the ways that she has been doing that, she's been using her Toby. She's been checking herself in and out of therapy. And before she leaves therapy or as she comes into therapy or even the Rett clinic, every time she tells them one new thing about herself. We were actually in therapy yesterday, and she told them that she wanted a baby doll for Christmas. So just letting them get to know little things about your child. It means a lot to the nurses and the receptionists and the doctors, and it's good for your child as well. So I encourage you to do those things, and I promise you that the team at Vanderbilt and the therapists and the receptionists, they're all very receptive to just stopping and waiting and giving your child time to talk about themselves and to advocate for themselves and say a little bit about themselves on their own. So that's one thing I really would suggest. Another really good resource that Tennessee has, and Vanderbilt is one of the reasons that we have this, is the Tennessee Disability Pathfinder. I put the phone number on this slide and the website. If you call them, especially, and you tell them what's going on, they're really good about giving specific resources that you may need, whether it's based on finances, school resources, equipment that you're looking for, support groups. Even some support groups are meeting online now. They're doing Zoom calls, anything like that. But that Tennessee Disability Pathfinder is a great way to find resources for a vast majority of issues that you may be dealing with, or things that you're going through, or just finding different ideas. So that's one that I wanted to make sure that I shared with everybody. The next one, I know right now, school looks different for everybody. It seems like one week my little girl is going to school with everybody, the next week just special ed class is going, and the next week everybody is virtual. And virtual learning is so hard for special needs kids, but especially nonverbal special needs kids, especially the ones that need therapy. So I'm getting a lot of questions from parents about IEP meetings. And so I wanted to share, if you're having difficulty with that, or you know someone that's having difficulty with IEP meetings or needing to change their IEPs, I encourage you to look up your local ARC chapter. There's a link on here to the ARC of Tennessee, and you can look up your local chapter from that site. But I encourage you to look up your local chapter, contact them. You can get an advocate for free. They'll walk you through your rights. Sometimes they will Zoom call into an IEP meeting. Sometimes they will come in person to an IEP meeting, depending on what is going on. I actually went to a 12-week course there at Vanderbilt and became an advocate myself. And I'm registered through the ARC. So they have a huge outreach of people that are wanting to help, and so I would encourage anybody that's having a hard time getting to therapy to school, or the resources of school, especially right now, to reach out to the ARC of Tennessee, and they can really point you in the right direction. The last thing that I put on there is to create an All About Me book, or an All About Me page. My daughter, Savannah, hers is on her Toby. And when she is having a really bad day or she's really frustrated, I feel like it's important for people sometimes it's not her normal. And so she can go to that All About Me page, or her teachers can go to that page, or her nurses can go to that page, or I can go to that page and talk with her and try to calm her down, talking about the things that she loves, sharing the music that she loves, or the videos that she loves. And that's a good way for people to get to know her, even if she's having a bad day. Because we all have bad days, and that's not always the normal, but it does happen. So I put that on there because I think that it's important to have that resource for the good days and the bad days. I wanted to end my section with just a little encouraging quote that I found the other day, and it says, "Sometimes even the greatest joys bring challenges, and children with special needs inspire a very, very special kind of love." I think that all of our loved ones with Rett syndrome encourage that special love, and I appreciate all that has gone into today. So, thank you for having me.
Thank you, Jamie. We had a little bit of trouble with your audio, but I think we got most of your information. Thank you so much for being a volunteer with our organization on top of your very busy life. I just cannot express how grateful we are to have you and your optimism, and what a beautiful quote that you ended with. Okay, thank you. We've gone a little bit over time, but everything that we talked about today was worthwhile to cover, and it is not the last time we will be together, but again, we got here today just to sort of recenter and refocus on Rett syndrome, because Rett syndrome persists regardless of what is going on in the world around us. And it is, I don't know about you, but if Katie's having a good day, I'm having a good day. And when she's not having a good day, nobody has a good day. And so that is independent of what else is going on in the world. So thank you for spending the time with us today to let you know that we get it, we understand, we're here for you. We have one more question in the queue that I was hoping Dr. Newell could answer, because it's from one of our newer families, and I think it's a common question, and it really deserves an answer, and that would be a great closing thought to talk about the regression period.
Yeah, great. Thanks, Paige. Yeah, so regression, you know, people with Rett syndrome have experienced this, where they lose some amount of spoken language, lose some amount of hand skills, and have difficulty walking. And it's a very common question of how long this regression is going to go on. One of the things to understand too is that we, you know, the rapidity at which the regression occurs and the onset in these different domains is variable amongst people. Some people have very dramatic regressions that occur almost overnight or within a very short period of time, and then they stabilize. Other people have more fits and starts, where they may lose a little bit of language, and then people notice over the next couple of months they're losing a little more, and then maybe a little later they lose some hand skills, and then they might lose some more. So it might be a longer period of time. You know, from the natural history study, it seems like probably in general, you know, from the time of the onset of the regression till the time that we really do feel like it's stabilized, you know, it might be overall about 6 months to a year, but that's highly variable and very individualized. And unfortunately, I always tell people we only really know the regression is over when it's over and it's been over for a while. So we oftentimes start saying, you know, I tell people, well, if you haven't been going for a period where it's 6 months, you haven't lost skills, we feel more confident that it's over the regression period. And if it's a year, we feel even more confident. And so that's kind of my timelines to tell people. But unfortunately, I wish I could give a very, very clear answer, but unfortunately I can't. One of the things too, I notice a lot that might come up a little later after sort of the clear regression of hand skills or and language, spoken language, is more onset of, that might come a little later, is more onset of particular aspects of gait and ambulation and walking. That and what I notice is after the regression period, and we feel a regression is over, we start families start noticing, well, she's starting to have more periods where she seems really scared when she's walking, and she's trying to walk, and all of a sudden just will stop and looks very scared. I usually don't think of that as a regression, but an early symptom of the gait abnormalities that we do see in Rett syndrome. So, but families will oftentimes say, oh, wait, you said the regression was over, but now she's having these issues walking. Again, I don't think of that as regression, just more a progression of different problems with walking that we do experience that might come a little later. So I hope that answered the question.
Thank you. Thank you very much. And, you know, and as a parent, I want to say to this parent and to all the new families on the call today, one, you can go to rettsyndrome.org education and find an entire hour on Rett Syndrome 101. So if you haven't had a chance to hear that talk, it was delivered by Dr. Ellen Percy, and you can hear more about all of the stages of Rett syndrome. But this is my message as a parent, that the term regression is a really scary one, and it's not a global one. So while your child might be having fine motor skills, gross motor skills, sleep issues that are new and scary and frightening, it doesn't mean that he or she is not going to be able to progress in other domains. So it's never too soon to start on communication. It's never too soon to start on comprehensive therapies, because it's not a global loss. And that term regression is frightening. Dr. Newell, I don't know if you would agree with me.
Oh yeah, I agree with you entirely. And I think that, you know, it's important to recognize that regression is not absolute. Some people oftentimes think that that means, oh, they will absolutely lose every bit of their vocal output or absolutely every bit of their hand skills. And that's not true for everybody. And the other is it's not just a relentless continual thing. It is time limited. There's a period of time when this occurs, and then it does stop. And then afterwards, we're in this what we call the plateau or pseudostationary phase. And one of the things I think is very important, and one of the reasons they call it the pseudostationary, is because it's not really just flat stationary. You know, we do think that with therapies and things, we might see some improvements. And more importantly, exactly what Paige was saying, it's time to start developing alternatives to meet the same needs, right? And that really is critical in the communication domain, finding alternative ways to develop communication. And Dr. Peters really hit on this. It's very important to empower your children to be able to communicate, because of course that lets them live their life to the fullest. And it also is very important because we do see some other problems that might come up with behavioral issues and stuff that really reflect a frustration of an inability to communicate. So empowering your children to be able to communicate is really critical overall.
Thank you so much. Okay, so that concludes our presentation for today. I really want to thank all of our panelists for being with us today and always. I want to thank our families for being here today and always for your children. Particularly for our team at Vanderbilt, we know you are healthcare essential workers, and it's been a very long number of months for you. And so we wish you well, and we hope that you have an opportunity to stay replenished through the holidays and get us to that moment where there's a vaccine and we'll be meeting together again in person. To our families, please take my advice to keep yourself replenished. Believe that there is hope on the horizon. Take care of yourselves. If you're not well, you can't take care of your child. And she is very sensitive to how you are doing. So it is not a selfish act to take care of yourself. And reach out to me, reach out to Jamie. We're here for you at any point in time. This is goodbye for now, but we will meet together again, either online or in the future as we have more time to gather a meeting. We hope to see you on Tuesday for our next Rett Ed. Enjoy the rest of your weekend. Enjoy this fall weather, and be safe. Wear masks, wash your hands, and we'll talk to you again soon. Thanks for your time today. Bye-bye.